Oh, my dear one, the actual yeast infection doesn't really have anything directly to do with having sex, except that anything that changes the environment of the vagina can essentially increase the likelihood of yeast proliferating. So for example, being on birth control pills, because it changes the acid-base content of the vagina, can sometimes increase your predilection for getting yeast infections. Stay away from those feminine hygiene sprays or douches, because again, it's kind of like a self-cleaning oven down there, and you don't want to overdo it with that stuff because often it will cause an imbalance which will favor the growth of yeast. Sometimes it's hard to tell after sex because of the irritation or the increase in discharge. Women often attribute that to yeast when in fact it may not have anything to do with yeast at all. So make sure that if you get a chance to go in and get checked and actually get a culture, you can be certain that it is in fact yeast that you're dealing with. So sex itself does not cause yeast infections, and yeast is not generally considered sexually transmitted. So make sure you get checked out and that is in fact what you're really dealing with.